How does your brain make sense of all that affect data? It's important to consider, especially since your brain is doing so outside our awareness, and it heavily influences your decision-making. In this video, let's dive deeper into how your brain adds meaning to the raw affect data in the form of emotions in effort to make you act in a way that keeps you safe. According to Lisa Feldman Barrett, emotions are not reactions to the world but active constructions of our brain, predictions, influenced by sensory input and past experiences. I know it feels like emotions just happen to us. It certainly doesn't feel like our brain is just making them up to help us. What? In fact, emotional reactions are a huge illusion created by our brain. These would be better named emotional predictions. The goal of this illusion is to keep us safe with super-duper rapid predictions, faster than thought itself. Predictions that are only made possible based on what you have experienced and lived through in the past. So rapid, it feels like it just happens to us. Much like a blind spot, none of us are aware that our brain is choosing which emotion is most likely to serve you, which emotion is most likely to keep you safe. The choice of which emotion will best serve you is not hardwired, but constructed by our brains based on past experiences and predictions. Past experiences, even those you don't consciously remember, are coded as sensations in one brain region and context in another. These experiences then get categorized as emotional concepts we call fear, connected, safe, joy. Yes, emotions are simply categories in a couple of file cabinets in your brain. Much like how the Pixar movie Inside Out depicts, each emotion is called upon moment by moment for a specific benevolent purpose, your safety. To understand how this works, let's again consider the visual system. What do you think is represented by this image? Right now, your brain, having no prior exposure to something like this, is trying to predict what the image might be. Are you ready to be cured of your experiential blindness? Were you cured? See how fast your brain adjusts to new information? Just like the visual part of our nervous system operates on prior experience, so does the emotional part. The same physiological response can be interpreted as different emotions based on the situation, the context, and individual experience. One example is the biochemical cocktail for anxiety is equivalent to that for excitement. So the prospect of falling hundreds of feet onto large boulders causes a similar physiological response as receiving a flirtatious smile. Both situations can increase heart rate and create a sense of arousal, but they are interpreted differently by the brain. So in the former situation, the emotion is fear. But in the latter, the emotion is excitement. The emotion your brain chooses will depend largely on context and your history. So when a rescue dog hears a doorbell, his brain predicts danger and therefore anxiously pees in a corner. In contrast, when a golden retriever hears that same doorbell, his brain predicts fun and novelty and therefore gets so excited he pees. Why are bulimic brains more similar to the rescue dog's brain? One reason may be that the first 12 months of life are crucial for the development of the vagus nerve and its resilience to stress. During this period, a number of factors can significantly influence how a child's nervous system responds to stress throughout their life. In this segment, we'll explore key insights from leading experts and discover practical strategies for fostering secure attachment and healing from unconscious or conscious trauma. For many years, bulimic behavior was primarily attributed to direct, identifiable causes such as sexual abuse or having violent, misogynistic fathers. These factors were believed to lead to a need for proxy forms of control, manifesting as eating disorders like bulimia. However, the sharp rise in anxiety disorders since 2010 has led researchers and clinicians to question these straightforward explanations. The increase in anxiety disorders has highlighted the need to explore other potential causes. First, the definition of trauma. According to Mastin Kipp, trauma is defined as trauma is any experience of threat, isolation, or overwhelm that results in physical or emotional injury that dysregulates the optimal functioning of one's body, emotions, brain, spirit, or health. When trauma is experienced during development, the nervous system defaults to predict danger, leading to chronic states of high alert, yellow-red. Pre-verbal trauma refers to traumatic experiences that occur before a child develops the ability to speak, but has long-term effects of early trauma on behavior and emotional regulation. A child who experienced early abuse might not remember the event, but could display heightened anxiety, difficulty in forming relationships, and an exaggerated startle response. They may present as a 35-year-old woman with chronic anxiety and relational difficulties, unable to recall any specific traumatic events. Ruth Lanius, Maryland, PhD, FRCPC, professor of psychiatry, teaches about two neurobiological underpinnings of preverbal trauma. The prefrontal cortex, responsible for regulating emotions and impulses, is not fully developed in infants and young children. This makes them more vulnerable to the impacts of trauma. Preverbal trauma can lead to heightened amygdala activity, which is responsible for the fear response. This can result in a persistent sense of danger and hypervigilance. Preverbal trauma can be further subdivided into three categories. Maybe one of these will resonate with your situation. Traumatic stress can lead to changes in gene expression without altering the DNA sequence. These epigenetic changes can be passed down through generations, influencing stress responses in descendants. Consider this case study. Research on the descendants of Holocaust survivors has shown that they exhibit altered stress hormone levels and a higher propensity for anxiety and depression, suggesting an inherited vulnerability due to their ancestors' traumatic experiences. Parents who have experienced trauma may struggle with emotional regulation and provide inconsistent or maladaptive models for their children. This can hinder the child's ability to develop effective self-regulation skills. In the best-selling book, The Body Keeps the Score, Dr. Bessel van der Kolk discusses how trauma affects not only those who directly experience it, but also their families. Children of trauma survivors often grow up with heightened sensitivity to stress and difficulty in forming stable, trusting relationships. Further consider the clinical observation that children of parents with PTSD or unresolved trauma often develop anxiety disorders due to the lack of a stable, regulating environment. Sympathetic dominance is also particularly common in individuals with infant issues, such as stress in utero, difficult births, ICU stays, and can even occur as a result of traditional sleep training or breastfeeding difficulties. Here's why. In utero stress transmission, maternal stress during pregnancy can affect the developing fetal brain, particularly the HPA axis and amygdala, leading to long-term impacts on the child's stress regulation. Research indicates that allowing a baby to cry it out can lead to increased sympathetic nervous system responses. The sympathetic nervous system is responsible for the body's fight or flight response, and its activation can lead to increased levels of stress hormones like cortisol. Breastfeeding and proper latching play a critical role in the physical and emotional well-being of both infants and mothers. The benefits extend beyond nutrition, affecting emotional bonding, stress regulation, and long-term health outcomes. According to Peter Levine, the first 12 months of life are crucial for the development of the vagus nerve and its resilience to stress. The trouble is, you are unable to remember any of this, so your sympathetic dominance may not make sense today. Now let's dive into the fascinating world of how early attachment relationships shape our brains, influence our emotional regulation, and affect our ability to form healthy connections throughout our lives. From age 6 months to 2 years, the brain, especially the right brain, is significantly influenced by social and emotional experiences. This is crucial for stress regulation. Healthy attachment relationships with caregivers play a pivotal role in healing post-trauma, while insufficient attachments can predispose individuals to PTSD. For example, a child with a nurturing caregiver who provides consistent emotional support is more likely to develop effective stress-regulating circuits in the brain compared to a child with a neglectful caregiver. Young children cannot regulate their own emotions because their brains, particularly the prefrontal cortex, are not fully developed. It is important for parents to help them develop this skill. This area of the brain is crucial for executive functions, including emotional regulation, and it typically reaches full maturity in the mid-20s. During early childhood, children rely heavily on their caregivers to help them manage and soothe their emotions through co-regulation. For example, a toddler who falls and scrapes their knee will look to a caregiver for comfort and reassurance, learning over time to calm themselves through these interactions. The right brain is dominant in processing emotional and social information. Trauma and poor attachment relationships can disrupt these processes, making it difficult for individuals to read social cues and manage emotions. This disrupts their core sense of self and impacts them the rest of their lives. Effective therapy involves right brain to right brain communication, focusing on nonverbal cues like facial expressions and tone of voice. This is why EMDR, emotional regulation chatbots, and journaling can be so effective. Early attachment experiences can shape future relationship dynamics, often becoming self-fulfilling prophecies. There are 4 main attachment styles: secure, avoidant, anxious, and disorganized. The skill of emotional regulation is foundational for forming healthy, interdependent relationships, avoiding addictive behaviors, and pursuing meaningful, challenging careers. Without this skill, individuals may struggle with impulsivity, relationship conflicts, and difficulty handling stress, which can hinder their personal and professional growth. In the coming days, we will start to play with questioning the default interpretations your brain makes. But not yet. Right now, we just want to notice them, particularly within the context of your social relationships and the physiological implications of using bulimia as a coping mechanism. Conclusion: understanding and addressing preverbal trauma requires a multifaceted approach that incorporates neurobiological insights, somatic techniques, and an understanding of the body's role in storing trauma. By creating a safe therapeutic environment and using techniques we teach like somatic experiencing and mindfulness, individuals can begin to heal from the deep-seated effects of preverbal trauma. See you in the next video!